We're live. This is the first public health Q&A following the Christmas break. So I will just hand over to you to introduce our guests. So Steve, you first.
Thanks, Royce. Steve Pintus, Director of Public Health for North East Lincolnshire.
Okay, and Geoff?
And Geoff Barnes, Deputy Director of Public Health North East Links.
Okay, thank you. So obviously, Prime Minister made an announcement last night, a new national lockdown. In a nutshell, what's different about this lockdown to previous the previous situation before Christmas? Steve, did you want to start?
Yeah, happy to. I think we're really now in a far more stricter lockdown than we were last week and build up towards Christmas. Obviously, it's a little bit more like where we started back last March. I'd say that the difference is we bring to all the learning and developments that have happened over the last 10 months. So things are far more better prepared than they were when we went into the first lockdown last year. There's far more support available to people in communities. We're far more better organised in terms of protecting both the health and social care settings, and the guidance that is available on gov.uk is slightly more nuanced. There are more exceptions, understanding the needs of people that to help them get through this 6-week period. Is there anything you wanted to add, Geoff?
Well, just in terms of the kind of specifics, obviously, compared with where we were in December in kind of tier 3 and within North East Lincolnshire, we're going to have all our non-essential shops that will be closed, and businesses ought to be supporting people to work from home wherever possible. Our schools will be closed except for key workers, and we'll be providing online support to other pupils, as was the case in kind of March and April last year. Exercise in your local vicinity is permitted, and we certainly would encourage that, but people shouldn't be travelling away from their local areas for anything but urgent reasons, and they're specified within the national coronavirus website.
So you said there that obviously people shouldn't be going out. What about the clinically extremely vulnerable, people with underlying health conditions? What's the message to them?
Well, essentially, the advice that applied in the first lockdown in March last year largely applies again. People will be getting letters from the NHS writing to provide advice. If you are advised that you're extremely clinically vulnerable, you should stay at home except for exercise or urgent reasons. Minimise contact with people outside your local household. Take advantage of online services for shopping and medication, etc. And there's lots of help available through our local volunteer services and online. You can find lots of information on the council website at the sort of help that can be accessed locally. Health services will continue to be available for health related issues, and there's lots of support out there for mental health related factors. I know that's been a big issue. I think we will be writing to all households in the area describing some of the support and the things that can be done to improve mental well-being. And again, we have the single point of access locally for information that you can't access anywhere else, which is available on 01472 256 256.
Geoff's quite right. I mean, the difference this time round, of course, is the weather is far more inclement than it was when the clinically vulnerable had to isolate themselves last time. And I think it's obviously we want them to take exercise both for their physical and mental well-being, but obviously it to take care, because I think some of the conditions will be slightly different to what they experienced the last time. So just a word of caution and not to take too many risks with regard to going out for exercise, but really important to get people through this period, that they do look out for their own mental and physical well-being, and don't completely hide themselves away in their houses or residence, that they do get out legitimately for some fresh air and physical exercise.
What do people need to do to keep themselves safe? I suppose there is obviously the coronavirus guidelines, which you'll come on to, I guess, in a second. But then obviously, like you said, the other aspect, which is making sure they're keeping their mind and their body healthy and getting that activity that they'd be getting normally in their day-to-day exercise that they won't be getting at the moment.
Yeah, absolutely. And well, I think again the difference is hopefully, we've got a glimmer of hope. We can look forward to the spring. That when things will be better. I mean, we can say that with confidence. Things will be better in the spring. There will still be restrictions, but things will be markedly better than they are now. I think the important thing for people is that they follow the basic guidance of hands, face, and space, and that doesn't go away. Whatever people hear about vaccines, etc., we must keep vigilant and keep to the guidance. And the other thing that's really important is that people do seek a test and isolate if they've got symptoms. That doesn't change. So despite us being in complete lockdown and people being encouraged to stay home, they still need to respond appropriately if they have symptoms, and isolate themselves within the home and seek a test. So that's really key, because it's still about restricting transmission of the virus, even with the national lockdown. And if we do that, we can keep the numbers down and keep the pressure off the NHS.
How are we doing as an area, Geoff? I'll come to you on this one.
Okay, well, yes, certainly our local rate is much reduced from where we were around November time. Currently we have the lowest rate in the Yorkshire region and Lincolnshire, but we still have around 100 people in northern Lincolnshire hospitals with COVID. The infection rate is more than 30 times higher than it was in September, and since Christmas we've begun to see our local rate escalate once again, which is a worrying sign. Unfortunately, if we follow the pattern that's been experienced in many parts of the country in recent weeks, it won't take long at all before we're back to November levels again, or even higher, as can be seen in what's happened in the kind of southeast part of the country with this new, more contagious strain. So yeah, we're in a better position than much of the country, I think, and the lockdown as it did last March should be helpful to us in hopefully stopping that escalation that has been seen in other parts of the country. But certainly this is not a time for complacency, and whilst the winter sort of situation remains, this virus will thrive, and with the more contagious strain even more so. So everything Stephen was just mentioning is going to be so important over these next 6 weeks, 2 months.
That's spot on, Geoff. And just to add, I mean, I think we are in a similar position to the first lockdown last March, and the reason that we benefited from that was that people did their bit and followed the guidance. And it's the same again, really. If people do their bit and follow the guidance, we will come out of this lockdown with lower numbers than elsewhere in the country. But that's the important key bit, is that we benefited going into lockdown with low numbers. We will see an increase because there is a time lag. And, I think we said before Christmas that we anticipated a rise in numbers owing to the Christmas bubble. It was inevitable, and that's what we've seen. And that's got to play out. So we're going to see a bit of a bumpy ride for the next couple of weeks, and we will see more hospital admissions, I suspect, and more care home outbreaks, and then it'll settle, and we'll see the national lockdown kicking in. But before that, we will see a rise in rates, so we shouldn't be surprised. But if everyone plays their part and does their bit, follows the guidance, seeks a test and isolates when they have symptoms, we will come out of this with comparatively low rates.
How long do we anticipate that this lockdown will last?
Well, I think the Prime Minister indicated, certainly when he spoke about schools, that it was going to last until the half-term break, so that gives us an indication of timescale. I think we're talking 6 weeks at least, and of course that it's fine for him to say that, and it's his job to say that sort of thing, but it will be dependent on numbers. So we have to see the impact of the national lockdown working in terms of suppressing the transmission. And as Geoff has indicated, there is this variant that is thriving in the southeast and Midlands. I don't think it's really reached our region to any great extent yet, and hopefully the national lockdown will prevent its spread. But that's what we'll be watching. So I think that the Prime Minister is giving us that optimistic outlook that by mid-February things will have settled and the national lockdown will have had its impact. But that's the best case scenario, I think.
Talking of kind of once it ends, one of the things that the Prime Minister said the lockdown sort of end would be dependent on is the rollout of the vaccine. How is that rollout going out with I know the Pfizer one's been used in this area for a number of weeks now. How's that going? Have we got any indication of how that rollout's going?
Yeah, we've made a good start with the vaccine rollout locally. We now have 4 primary care centres providing vaccination. We've already reached a large proportion of our over 80 population getting the first dose of the vaccine in the last few weeks, and are starting to roll out the vaccine into care homes over the next few weeks. The Prime Minister's highlighted he wants to see the top 4 priority groups vaccinated by mid-February, and we're going to be aiming to achieve this. The authorisation of the Oxford-AstraZeneca vaccination that you mentioned should help, as it's logistically much easier to transport and store. But we need to note this is going to be the biggest vaccination programme ever delivered in the country, and it will inevitably take time. Staff are being recruited to support the rollout, and we're looking into the possibility of opening a mass vaccination centre in the borough to ensure that happens. So all told, great start. We're working very closely with the CCG to get this implemented. Massive amount of work to be done over these next few months to roll it out in an incredibly quick time.
Well, that wraps up all the questions from me. Are there any final words from either of you?
Just on the vaccination programme, I think, just to remind people, be patient. They will get invited when it's their turn. So it's no good clamouring for the vaccine. There is a programme of prioritisation that Geoff referred to, and that's what they're working to. I think again, the Prime Minister quite rightly, gave us that ray of hope, that timeline, that indication. But as Geoff said, this is a huge undertaking, and we have the capacity, we have the staff willing, ready to deliver the vaccine. I think the limiting factor will be the availability of the vaccine and the speed with which it reaches our area. So that we've just got to be cautious and sort of plan, as Geoff indicated, for that really scaling up of delivery. And as long as the vaccine comes through to the area, then we will deliver it.
Okay, thank you both for your time.
Cheers.